Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracedo is interpreting the press conference in Spanish. His interpretation will be available on the county's website shortly after we conclude this press conference. California is now the epicenter of the coronavirus crisis in the United States. The California Department of Public Health is reporting California has set nationwide records for new cases again and again in the past week. Yesterday, there were more than 50,000 infections, with over 100,000 in the past 48 hours. If California were a country, it would be among the world leaders in new coronavirus cases, ahead of India, Germany, and Britain. The state's test positivity rate continues to climb because the virus is spreading faster. The rate is now 11.3%, more than twice what experts consider high risk. The state is now recording an average of 220 COVID-19 deaths a day over a weekly period and about 38,000 daily cases. Both are records and both quadruple the numbers from mid-November. The enormous wave of infections comes as hospitals are already inundated with record numbers of coronavirus positive patients. The most recent record high hospitalizations do not account for the increasing numbers of new infections, a chilling prospect for our state's stretched thin hospitals and exhausted healthcare workers. The number of available beds in intensive care units is plummeting. In the San Joaquin Valley, hospitals ran out over the weekend, resorting to surge capacity. In the Southern California region, ICU capacity fell to 0% on Thursday. Because it takes on average more than a week for people to get sick enough to be hospitalized, Thursday's capacity numbers actually reflect case numbers that are roughly 10 days old, when the state was reporting a daily average of 10,000 fewer infections. Dr. Del Reynoso will provide details on the increasing local cases along with updates on local hospitalizations. Despite the grim news about increasing cases, there is also some good news to share. The first doses of Pfizer's new COVID-19 vaccine have arrived in Santa Barbara County. The new vaccine was injected into the arms of frontline healthcare workers at Cottage, Marion, and Lompoc hospitals yesterday, as well as Dr. Fitzgibbons. Dr. Anzorg and Dr. Fitzgibbons will both report on the newest available information on local vaccination efforts. Governor Newsom recently said, "There's a light at the end of the tunnel, but we're still in the tunnel." And that means we're going through perhaps the most intense and urgent moment since the beginning of this pandemic. Governor Newsom added, "We're not at the finish line yet, so please, please, please be mindful." I'd like to add my plea by asking all of us to resist temptation to gather over the holidays. It isn't too late to cancel plans that include gathering with people outside your immediate household. We're at an extremely critical point in time right now. Lives and livelihoods are at stake. Please help us keep COVID-19 cases from continuing to increase by staying home as much as possible. As the pandemic health crisis is escalating locally, the economic crisis local residents and local businesses face is an equally critical issue and always at the front of our concerns. Every one of us needs to do our part to help local businesses survive through this tough economic time. Please do your holiday shopping locally this year and support local restaurants by ordering takeout food as much as possible. I want to sincerely thank the many local businesses who are following safety guidelines and state guidance despite the extreme financial hardship this responsibility bears. Earlier today, I led a Zoom meeting with California Secretary of Health and Human Services, Dr. Mark Galley, where county officials asked him to give our region an opportunity to better control our own destiny through the creation of a new Central Coast subregion with Santa Barbara, Ventura, and San Luis Obispo counties. Joining me on the call were State Senator Monique Limon and Assemblymember Steve Bennett, who both expressed strong support for the county's proposal to Dr. Galley. I shared with Dr. Galley my concern that local residents are getting frustrated because they believe their individual actions and our community-wide responses to COVID-19 is lost within the very large context of the 20 million Southern California person region. I explained to Dr. Galley that throughout the pandemic, our local response to COVID-19 has consistently been better than other counties and regions. Dr. Galley's response to our proposal was very encouraging. He expressed appreciation for the excellent work our county has done working in collaboration with the state to reduce the spread of the virus. He promised to seriously consider the county's proposal and committed to continuing the dialogue. We will continue to press our case through every means available, and I remain hopeful and optimistic that we can find a path to success. Since the onset of the pandemic, ordinary people have teamed up to accomplish extraordinary things. From food distribution programs to efforts to help seniors, we've seen so many heartwarming stories of community members supporting each other during this challenging time. While the COVID-19 pandemic has been devastating to our community, seeing people show up for each other is definitely a silver lining. Earlier this week, I learned about the Families Feeding Families program, a grassroots effort that has been spearheaded by Nisi Cox, Kathy Nitchis, and their friends and neighbors. Over the past several months, Families Feeding Families has regularly helped more than 50 families on the west side of Santa Barbara, providing them with a generous supply of nutritious groceries every 2 weeks. Most recently, the group provided holiday gifts for dozens of children in the community. All this work is made possible by the donations of community members. To learn more about how you can help support this effort, please visit familiesfeedingfamilies.org. Thank you to everyone who is stepping up to support our community during this time. Always remember that even a small act of kindness can go far during this challenging time. I'd now like to introduce Dr. Joe Reynoso, the County Public Health Director.
Thank you, Supervisor Hart. Santa Barbara County is currently experiencing a second wave of COVID activity. Our first wave was over the summer months. This second wave started early November and is likely going to be larger than our first wave. To date, our COVID metrics continue to rise, indicating that community transmission is ongoing. It is unclear how long this increase in COVID activity in our community will last. With the winter holiday season quickly approaching, we are concerned that cases from family and friends gathering will continue. We know that Thanksgiving gatherings contributed to high rates of COVID transmission. In the weeks following Thanksgiving, our COVID case rate, number of newly reported cases, number of active cases, and hospitalizations have spiked to unprecedented levels. Since Thanksgiving, Santa Barbara County's unadjusted case rate has increased by 67% to 30.96 per 100,000. In addition, during this time, testing positivity again doubled and is now at 8%. Active cases have increased nearly threefold to over 1,100 active cases in Santa Barbara County. On December 14th, 360 cases were reported to Santa Barbara County, the highest number of community cases ever reported in a single day. Our hospitalization numbers are as high as they have ever been. Santa Barbara County is also experiencing a peak in outbreaks at congregate settings and businesses. During the week of December 6th through December 12th, we began investigating and mitigating new outbreaks in 17 congregate settings and 6 business settings. All this data indicates that COVID activity is at the highest level it's ever been in our county. Many have continued to ask why the state has imposed the regional stay-at-home order, which has restrictions on business operations. Simply, it is to reduce the movement of the community and the mixing of households so that we can decrease our cases. Our high case rate and testing positivity means that we continue to have significant disease transmission in Santa Barbara County. The high and increasing levels of COVID-19 cases in our county increase the risk of infection and spread of disease. The impact of the widespread disease transmission in our community is significant. Our local homeless shelters are currently closed to new admissions due to outbreaks or fear of outbreaks. We have 17 total outbreaks in congregate settings. our hospitals have reduced capacity and are delaying non-emergency surgeries to ensure sufficient beds for COVID-19 patients and emergencies. We know from our contact tracing that the disease is spreading across the county and is not isolated to just one community or area. The need to stay home and the impact of not doing so is seen in our climbing case rates. Thanksgiving gatherings, travel, and simply joining with someone outside your household for coffee or for lunch, or even catching Monday Night Football with friends have all been detrimental to our whole community. Say no to gatherings outside of your household, please, just for a little bit longer. Today, we are sadly reporting our first pediatric death associated with COVID. The decedent was between 12 and 17 years of age and resided in the city of Santa Maria. This devastating news reminds us all the severity of this pandemic. I am again urging all community members to keep each other safe by avoiding gatherings over this winter holiday season. As cases, hospitalizations, and deaths continue to increase across our country, our state, and our county, the safest way for us all to celebrate winter holidays is to be at home with the people we live with. Travel and gatherings with family and friends who do not live with you will increase your chances of getting and spreading COVID-19. Thank you for all of you who are doing everything you can to decrease cases. This is not forever. The vaccine is here. Each of us will soon have a turn to be vaccinated. And once all of us have had our turns, we can then gather with friends and family safely. Thank you.
Thank you, Dr. Del Reynoso. Dr. Henning Ansorg, the Santa Barbara County Public Health Officer, is also here with us today.
Thank you, Supervisor Hart. Good afternoon, everyone. You may have heard that the first shipment of the new COVID vaccine did arrive at our local hospitals yesterday. We are relieved to know that the hospital staff who is caring for our sickest, whether it's COVID or non-COVID patients, that they are now able to receive the best protection from this potentially deadly virus. It is really giving us a much-needed shimmer of hope to know that we are now on our way to getting ahead of this pandemic through a very effective vaccine that will eventually lead to general immunity. A second vaccine product by the company Moderna is currently in the confirmation process at the FDA, and we expect it to get approved as early as this Sunday. Once approved, Santa Barbara County is slated to receive the first shipment this upcoming week. The Public Health Department is following a very thoughtful prioritization protocol created by the Center for Disease Control and the California Department of Public Health. It makes sure that the first recipients of this immunization are persons who are at highest risk for either getting infected, like the healthcare workers, or suffering severe illness when infected, like the elderly. After hospitals, nursing home staff and their residents are next in line, followed by paramedics and others who are providing emergency and general medical services. The exact list of eligible healthcare-related facilities and agencies is published on the CDPH and Santa Barbara County Public Health websites. The manufacturers Pfizer and Moderna are planning to ship on a weekly basis. We are hopeful that by the end of January, the highest priority recipients will have been immunized. Once the vaccine is available for the general public, the Public Health Department, as well as our local healthcare partners and pharmacies, will offer the immunization free of charge. The Public Health Department will announce where our immunization clinics for the public will be held, similarly to previous mass vaccination events for the flu. Both new vaccines need 2 doses. Every immunization will be logged in a specially created national COVID vaccine database, which will be utilized to track the date of receipt of immunization and to check on reactions for safety reasons. In the meantime, please stay the course. Protect yourself, your loved ones, and your community by wearing a mask, keeping social distance and avoidance of gatherings other than with your immediate household members. Thank you for your cooperation.
Thank you, Dr. Ansorg. I'm also very pleased that Dr. Lynn Fitzgibbons, Cottage Health's infectious disease specialist, is also here with us today to share her recent experience getting one of the first local vaccinations for COVID-19. Welcome, Dr. Fitzgibbons.
Thank you, Supervisor Hart, Dr. DiRenoso, and Dr. Ansorg, of course. The County of Santa Barbara, of course, had a very exciting, historic, monumental day yesterday. But I wanted to explain a little bit of the background. Cottage Health, many of our other healthcare partners around the community, has enjoyed a very strong partnership with all of the county, particularly, of course, the Public Health Department, for months with regards to vaccine planning, preparation, distribution, and of course, administration. There have been months, as you may have heard, of frequent meetings with the health department and our healthcare partners. And at Cottage, we've had really extensive internal work, readying everything from logistics and storage to organizing our location, the staffing, and what ultimately has been the implementation of a mass vaccination effort. All this, remember, in the setting of a pandemic with an infectious disease, a virus that actually requires us not to bring people together, resulting in what I think has been really this remarkably precise and well-orchestrated, again, mass vaccination effort just over the last 24 hours, much like a military exercise, perhaps. As I said yesterday, I'll just repeat quite clearly, particularly in front of my three colleagues and friends, gratitude. Gratitude at everything that you did to bring the vaccine to Cottage and to others in the front line across our community. This morning, our president and CEO, Ron Werft, I think best described it when he said that our vaccine site, our vaccine center, rivaled Disneyland as perhaps the happiest place on earth. I think I did see a surgeon almost skipping out of the vaccine site after he received his own vaccine. And I'm so very proud to say that by the end of the day today, we're going to have vaccinated 250 frontline healthcare workers at Cottage Health. Definitely a buzz in the air. I can also touch briefly on my personal experience with the vaccine, now about 24 hours after I received it, as you can see behind Supervisor Hart. I'm happy to tell you that I had a slightly sore arm. It was worse about 12 hours after I received the vaccine, and it's now essentially gone. I'm grateful I didn't have any of the brief systemic side effects. Remember, systemic side effects are those symptoms like fevers or chills or perhaps fatigue, although I'll point out that fatigue is relative, and I think I probably have an equivalent level of fatigue to my expert panelists here, in good company, certainly. I just want to perhaps conclude my comments about the vaccine to, I think, echo Dr. Ansorg. Remember that this vaccine is poised to play a critical role by quickly protecting our most exposed and our most vulnerable. But as Dr. DiRenoso told us, it is not an immediate solution. Even with the seamless vaccine rollout that is well underway, it will be many weeks and likely longer before we have a substantial proportion of our community protected. And so in thinking about what those weeks ahead will look like, I think it's really a reminder of that critical need to remain vigilant, particularly with these holiday weeks ahead. Masks, distancing, making those tough but kind decisions not to get together with family outside of your household is what is going to make the difference. As Dr. DiRenoso mentioned, in the hospitals across our community, we are currently experiencing the Thanksgiving bump, and it is huge. That Thanksgiving bump was a bump that occurred in the context of numbers that are trivial compared to what we are facing today. And if we see anything like a superimposed bump from Christmas, New Year, or any of our other holidays, we are potentially in for some very, very tough days and weeks in the next month ahead. So finally, just a few comments from what it's like in the trenches, how things really looked at the hospital today. As I think you know, I work in the COVID unit every day, and I can say that we have a remarkably hardworking, dedicated, but very busy staff. We have, as you've heard, record number of patients and record number of new admissions. Our peak over the summer, the busiest week we saw over the summer, had 26 new admissions at Cottage Health. Yesterday, we had 11 in one day alone. And while we currently have the capacity to keep doing this work, every day that brings a new record, every admission of an unwell, often very scared community member reminds us that we must listen to this excellent public health advice. We must wear our masks. We must make those tough but kind decisions. And we must do whatever we can in the weeks until the vaccine kicks in to bend this curve. Thank you, Supervisor Hart.
Thank you, Dr. Fitzgibbons, and thank you very much. We can't express our gratitude for all of your colleagues and your work at Cottage and all the other frontline medical workers to protect us every day. Thank you.
Thank you.
We'll now go to questions from the room. Mr. Devine?
First question for Dr. Vondo Reynoso. Obviously, there's widespread community transmission, but I guess I speak for a lot of people that have been hunkered down, especially with this new regional stay-at-home order. Where are these new cases coming from? What are some instances that people can kind of reference to stay away from those activities which are causing the spread?
Unfortunately, it's happening across our county, in all of our jurisdictions, in all of the areas, and I would have to say in all of the levels of activities. Now, there are activities that are higher risk, such as gathering with those who are not from your own household, to lower risk activities like enjoying the outdoors by yourself or with members of your immediate household. So I would have to say that based upon what we know from our contact tracing, that the cases are due to gatherings and being around people who are COVID positive. So that is why we have a regional stay-at-home order, so that we can minimize our activities outside the home other than for the critical, essential activities.
And then obviously there's 17 outbreaks at congregate care settings. Are these all senior living facilities or a variety of?
There are a variety. So some of them are skilled nursing facilities. Some of them are long-term care facilities. Some of them are congregate setting, homeless shelter, various.
Okay. And then the last question for me, it could go to any of you guys, but at this point with all the winter holidays causing more and more COVID cases, are we at this point at a point where the vaccine is really the only way it'll get back down to the level it was before November? Or if we do due diligence, could we see the community get back to a point as we were in October when we were back in that red, potentially orange tier zone?
Perhaps we'll take turns.
Yes.
I believe in our community.
Yes.
Period. We did it before. We're doing a good job. We're just at a very vulnerable place. And the reality is it's going to be weeks. It will likely be a small number of months before we have really such a substantial proportion of the community protected by the vaccine that we're going to really feel that effect on the curve. And so I think your point is well taken. I think it is going to be all of these measures that our public health officials are reminding us of that is going to bend the curve. That's from an infectious disease perspective, that's my feeling, but I'll defer to my colleagues.
I would agree with that. I am very hopeful. I believe that the majority of our community will adhere and will think twice about celebrating this winter holiday and doing it so with the immediate household. I do believe that. And I think that because the majority of our community members have done that, we didn't see a catastrophic increase in cases like in other communities. We saw an increase. It's a worrisome increase, but it was not catastrophic. And I hope that we can prevent that. Let's not throw in the towel. Yes, it's winter. Yes, it's the winter holidays coming around, but I do believe that our community can stay the course and improve and make traction on our cases.
Thank you.
Thank you, Mr. Devine. Ms. Holland?
Yes. I was wondering if one of the doctors could provide some safety tips for people who are, let's say, dropping off holiday presents or delivering food for other people during this holiday season. Like dropping off presents at their house or anything like that.
Maybe I take a stab at that. So I strongly recommend to avoid as much contact as possible. So unfortunately, the gifting has to happen in a more impersonal way. And drop off the box and give a call and say it's there, and maybe do a Zoom call or something. Don't forget to interact and connect with loved ones, obviously, and sharing of gifts is an activity that really enhances that. But the hugging and the close contact is just what is feeding the virus spread. So that has to be avoided by all means. It's really from person to person. It's not so much from packaging or anything like that. So I think that is the main way to avoid the spread.
Yes, we all need to play Santa, delivering, dropping off the present, and disappearing, and then perhaps joining virtually in the opening of the presents.
Okay, great, thank you. And then I know the Sheriff's Department puts out information when they have new cases among their employees, and I was wondering if that was considered in one of the 6 businesses with an outbreak, if they're rolled into a business.
Yes.
Yes, okay, thank you for that clarification.
Thank you for the question. We'll now answer questions on the phone.
Yes, first up is Tom Bolton with Newshawk.
Oh, thank you very much. We're roughly 3 weeks out from the Thanksgiving weekend, and I presume that a lot of the cases and hospitalizations we're seeing are a result of gathering and travel from that. I guess I would wondering if somebody can give us a sense of, are we at the peak of the impact of that? Do you think that peak is still to come? Where do things sort of stand from your best guess?
I can start. I think what we're seeing is a confluence between Thanksgiving travels and gatherings, and now we have the winter holidays coming up. So there's going to be emerging from those two major holidays and the gatherings and the travel associated with those. So and then we have New Year's coming up as well. So with regards to have we peaked, I don't think that we have peaked. I think that we will continue to see cases until the end of January.
Okay, yeah, I guess my question, but the first part of my question, because I have a follow-up to that, is I realize that there's more holidays to come, et cetera, but do you think that we've seen the worst of the impact from the Thanksgiving holiday at this point, or do you think that's still to come, notwithstanding that Christmas is a week from now?
Perhaps from the hospital side, I can comment. We have to remember that just because a transmission occurred at Thanksgiving doesn't mean that that transmission event is going to potentially result in hospitalization and then the curve will downturn. What we have to remember is that transmission event that resulted in infection has the potential to set off its own set of dominoes. And so what I mean by that is the transmissions that we saw over Thanksgiving, the transmissions that I'm seeing in the hospital, they're already second-degree events from what happened at Thanksgiving. Absolutely, I am seeing people who were exposed over Thanksgiving, but I'm also seeing people who were exposed to people who were exposed over Thanksgiving. And that is perhaps the biggest challenge.
Okay, that definitely answers the question. So I guess the related question is, and I think maybe you've at least partially answered it, is with Christmas coming up and perhaps New Year's, despite all of your great advice and pleadings, it seems likely that some people are going to still gather. So is it safe to assume that we will see another, I don't know what you want to call it, mini surge following those events?
I'd like to be pleasantly surprised and see us plateauing, but the reality is that we are projecting the rate of increase to continue, but would love to be pleasantly surprised.
Okay, very good. And then one other question, is a little bit of a technical question. We track the episode cases on a daily basis, you know, based on the dashboard, et cetera. And those numbers change on a daily basis, not just for that day, but going back. I understand why they go up, because I assume you get new data, but in some cases they've gone down substantially. And I was wondering if you could just explain why that happens.
So as we scrub, for lack of a better word, as we scrub the data, as the state cleans the data, as we clean the data, between our outbreaks team, between our epi team, between our disease investigators, that number gets adjusted to more accurately describe the incidence, the infection date, and the course of disease.
Okay, thank you very much.
Thank you, Mr. Bolton.
Thank you, Tom. Next up is Laura Place with Santa Maria Times.
Hello, I have a few questions. My first one was regarding contact tracing and, you know, the kind of workforce that you all have of contact tracers right now. I think it was mentioned earlier in the week that there's a bit of a, you know, maybe not a bit, a large kind of delay in being able to contact everyone who's been infected just because the number of new cases is so overwhelming. And I was hoping to get a little more context on that. Like, is there, at this point, are you all seeing like a multi-day delay from contact tracers and being able to contact people who are infected just because of the overwhelming surge, or what does that look like?
Well, you're right. It is an overwhelming surge for the contact tracers. We are expanding the team. We are anticipating 5 more coworkers in the very near future. So far, we have anticipated to reach somebody on 3 consecutive days. We had to cut this back and attempt 2 days in a row, and then if we don't reach someone. However, we are staggering our times to improve our effectiveness because some people do still work, or so they cannot be reached between 8 and 5. So we will have teams that call early in the morning and teams that call in the evening to increase our effectiveness and of reaching people. We have not decided to give up on contact tracing at this point, but we want to optimize it. But we will probably have to cut back on questions asked and things like that just to speed up the process. So we are very much still in action mode in improvement of our current contact tracing protocol, and hopefully that will have a good impact on being able to warn people who could have been exposed.
When you say, you know, cutting back on some of those questions, is that like maybe some demographic data that you could use for research, like cutting back on those?
I'm not exactly sure which questions we have to cut back on, but we just have to make sure that we are getting the most important data, and the most important data at this point are probably that we can identify people who are exposed.
Okay. And just to make sure I understood you, so you said that you know, contact tracers will try to reach out to people, and if they don't hear back for 2 consecutive days, then they have to kind of move on. Is that correct?
That is correct. We can keep trying, but then again, we will stagger the times that we try to reach them to make sure that it's not our fault that we don't reach them because they're not at home or not able to take the phone call. So.
Okay. And when you mentioned, you know, how you said we're not giving up on contact tracing yet, is there a point where that process would kind of be moot just because of the overwhelming number of cases? Or is that not, a possibility right now?
That is being discussed between different counties and especially large urban areas, but we feel also emboldened by the fact that Los Angeles is still trying really hard. We are optimizing the software that we're using, and so we are following LA's lead on trying to streamline and optimize our process so that we can still be effective.
Okay, thank you. And then another question, it's one that's been asked before, just as cases surge throughout the region, especially in areas like LA, about whether our local hospitals are accepting any patients from other areas. So I was wondering if we could have an update on that for this week.
So as Dr. De Reynoso had mentioned, Cottage has reduced, I would say, what we call elective procedures, and really stopped what we call elective procedures, and really focusing on emergent and urgent scheduled procedures and surgeries. That's, of course, a response to the strain on our capacity. And while the good news is we have ICU capacity at this point, staffing continues to be a top concern. With staffing having been a top concern for now several weeks, we have not been accepting extraordinary transfer requests from outside of our usual catchment area. We're, of course, a referral center for strokes, for cardiac problems, for a variety of other really, I think, key, critical, life-saving medical care across the Tri-County region. And at this point, those transfers are being reviewed, even if they would otherwise be regarded as a normal transfer. But any transfers from within the Tri-County usual catchment area are being reviewed by a subset of our incident command group, really to make sure that before accepting transfers, we are thoughtful, careful, and make sure, of course, that we have capacity.
Dr. De Reynoso, did
Is
you
that
have
true?
something?
Yes.
Oh, sorry, go ahead,
Just
Dr.
one
De Reynoso.
second. Please go ahead, Dr.
Supervisor Hart, I have some pretty exciting news to share. Our Jackie Ruiz, our PIO, just texted me that the FDA gave formal authorization for Moderna. So what that means to us is that we will be receiving the 6,600 doses a lot sooner than anticipated. So that's incredibly good news, and it brings more hope.
Thank you for sharing that. Ms. Place, did you have another question?
Yeah, and that's great news. Thanks, Dr. De Reynoso. Yeah, well, going back to what I was just asking, a follow-up to that, as far as COVID-specific patients, Dr. Fitzgibbons, would that be, kind of fall within that process you were talking about, where right now any transfers of COVID patients from overwhelmed hospital areas are just being carefully evaluated? Or is there more room to accept those patients just because of, the overwhelming lack of capacity in other areas?
So over a month ago, we had 2 patients in isolation the beginning, middle of November, and were asked to accept 2 patients from outside of the area. And we're actually asked to accept more than that, but we're able to support that request at the time, again, back when we had 2 hospitalized patients from the entire region in our hospital. Since then, things have changed, and so really, I can't well articulate just how many requests come to, I imagine, all of the local hospitals, but certainly Cottage, with regards to transfer requests from around the region, particularly, as you say, with patients who have COVID. And as I mentioned, really our approach has been that we are working very hard to assure that we have staff in place to provide hospital capacity for our Tri-County area. and have not been accepting COVID-related transfers from outside of our usual catchment area for over a month now.
Okay. Thanks very much.
Thank you, Ms. Place.
Thank you, Laura. Next up is Lisa Osborne with KCSB Radio.
Thanks, Gina. Hi, everyone. Dr. Fitzgibbons, you were mentioning that your biggest concern is staffing. Are you working on plans to try to bring in more qualified staff as cases grow? And then also eventually, if the rooms fill up, what are you thinking about as far as expanding if we had a bump like we did over Thanksgiving, over Christmas and New Year's, heading into the new year?
Thanks. It's a great question. And I would say, so just to remind everyone, at Cottage, we have an incident command center that meets for about 2 hours every single morning and often on the weekends when there are active problems. And I would say that much of that conversation most days is dominated by exactly this question. There are many, I would say, conventional but also creative approaches that we have employed already. Examples include perhaps the one I'm most excited about, but as we looked ahead over the summer and saw that we were going to have potentially a need for more ICU level nurses, we were able to cross-train 45 med-surg nurses from the regular floors to team up with critical care nurses. They weren't able to be by themselves essentially working the ICU, but they were able to do this approach of team nursing, which really improved the ability to care for more patients with just different staff essentially. So there are approaches such as that. As I think everyone's well aware, the access to travel nurses has been incredibly challenging. We often use travel nurses at Cottage, and of course that pipeline has very much dried up, really based on the dire situation across the country and across the state with the need for travel nursing in so many places. But of course we've already touched on adjustments within our system too, within the services that we're providing. For example, the adjustments in the operating room and procedure suites that have the ability for us to flex staff around the system. And so again, much more to say on this, but I would say we're using a variety of approaches to make sure that we have enough staff in place to care for the patients that are here.
Lisa, did you have additional questions? I think she's muted, and that would conclude our Q&A.
Thank you for
everyone.
those questions. Our next press conference will be held on Tuesday, December 22nd at 4:30 p.m. While there's not a scheduled press conference for the following week, a press release will be sent on Wednesday, December 30th with a report on the new cases and an update on any other breaking news. Our press conferences have occurred weekly since March 12th, and we'll continue to provide them with consistent, timely, trusted information directly to the public and the media. We'll also continue updates to the Board of Supervisors at their regular meetings. In addition, we'll continue to provide updated information on county websites throughout the holiday period. The Public Health Department and all other critical county functions will not pause during the holidays because the virus doesn't take the holidays off. Beginning in the new year, our weekly press conferences will be moving to a Zoom format. From the viewer's perspective, the broadcast will not change. The first new Zoom format press conferences will be held on January 5th and January 8th. Please remember the best place for consistently reliable and detailed information about the coronavirus pandemic and other local public health orders remains publichealthsbc.org. You can always rely on the county website as your trusted source for accurate information about Santa Barbara County's pandemic response. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. This year, we are stronger together, safely apart.